Good morning, everybody, and welcome to our next in the series of our PRAXIS Plus webinars. We'll just give everybody a few moments to join us. We had some little bets offline about what number of attendees we might anticipate. So we'll see how we go about reaching our target. We have over 260 people registered for today's session, so let's see how we go. But anyway, we welcome you. And we're really looking forward to today's discussion. So let's just give it another 30 seconds and then we'll kick off. All right, let's get started. I might just ask our panelists to all mute themselves if that's okay. Thank you. So my name is Melanie Gentgall, for those people who haven't met me before. I'm the CEO of PRAXIS, and we're delighted to bring you today's session around consumer involvement in research. But the aim of today's session is really to explore what are some of the levers that we could activate to really try to start embedding consumer involvement in research. We now have some incredible tools that are available to us as a sector to help us understand the role and the operationalisation of consumer involvement in research. But I think we're still lagging behind, and we're not seeing that very deeply embedded involvement of the consumer voice in research, design and practice. So today's discussion, as I said, is really about how can we improve the way that we actually think about involving consumers right from the concept of research, design and research questions. So I'd first like to acknowledge Australia's First Nations people as the traditional owners and caretakers of the land that we all live and work on across wherever you're joining us from today. I'm speaking to you from the very beautiful lands of the Kaurna people here in Greater Adelaide. It is a little cold and overcast today, not looking very beautiful, particularly my outlook in the office. But, and I know we've got people joining us from varied lands on our panel and of course in our audience. So we pay our respect to elders past, present and future, and we acknowledge their connections to lands, cultures and waters. Bit of housekeeping for you all. This is a webinar format, so your cameras will be off and your microphones will be off. We encourage you to use the Q&A function in Zoom, and we're all very familiar with Zoom these days. If you can pop your questions in there, I will then curate the questions for the panel as we go through the conversation today. We do want this to be as interactive as possible, so please feel free to ask your questions. If we don't get to them during the discussion, then we'll do our best to come back to you after the session with a bit of a discussion tool that will answer some of those questions that we didn't get time to consider. We will also send a link to a post-session survey. For those people that complete the survey, we will issue a certificate of attendance. We won't do that for everybody, but we will certainly do that for those people that take the time to help us to understand how we can improve what we do. So a bit of an introduction to our panelists, and I'm not going to give you too much detail because time is limited. And I'm very happy for our panelists to introduce themselves when they start speaking. But let's go around the room. And firstly, Chris, if you can put your hand up. So Chris is a co-founder of the Genetic Epilepsy Team Australia and founder of SCN2A Australia, and has served as a board member in the disability sector. She's also a mum to a son with SCN2A, which is a genetic disorder that is one of the most common causes of neurodevelopmental diseases. And so we invite Chris onto the panel today as a consumer advocate and as someone who is becoming more and more involved in the role of the consumer in research and clinical trials. So welcome, Chris. We also have Trina O'Donnell. Trina, pop your hand up, who is the Bilberry Operations Manager, and she's our all-round HREC expert and will be here to help try to distill some of those questions around the role of the HREC in embedding consumer involvement in research. We also have Leanne Weeks, who is the Director of CTIQ. Leanne, in collaboration with CTIQ, in collaboration with ACTA, has released the Consumer Involvement Toolkit, which I think has been a place setter in the Australian sector for promoting access to tools for involving consumers in research. So welcome, Leanne. It's great to have you here today. We also have Anne McKenzie, our multi-award winner, consumer advocate, and really, I think many of you on today's call would agree Anne has very much been the place setter for really shaking up Australia in regards to thinking about the important role of consumer involvement in research. And it was recently the NHMRC Consumer Involvement Award winner. So we're very fortunate to have Anne here. She's also the Consumer and Community Involvement Manager at Telethon Kids. So welcome, Anne. And also our lovely Liz Wilson, who's the Director of Prime and Partner Sites, ANZ and Early Phase Oncology Haematology Network Lead for IQVIA. And Liz is also an advisory board member for the White Coats Foundation, which of course is another consumer involvement organisation here in Australia doing great work. So welcome to you all. Let's keep moving, and we have a poll question to get us started because we want to know a little bit more about who's in the audience and who's joined us today. So just bear with me while I launch this poll. And in this poll, we want to find out, have you begun really thinking about embedding consumers into your research? So I'm going to launch the poll and away we go. Now, I recognise that depending on the device that you're using, you may not be able to access the poll, and that's absolutely fine. It's just a way for us to get a feel of who's in the audience and how involved they are with embedding consumer involvement in research. So we'll give this just another 10 seconds, but thank you. We've got nearly 80% of you who have voted and some interesting results. So let me just end the poll and share those results with you. So we have a majority of people who said that consumer involvement in research is not applicable in their current role, but then closely followed by many in the audience, so 30% of you who have said, yes, you are just getting started with embedding consumer involvement, which is great to see. When we did a consumer involvement in research webinar about this time 12 months ago, that number was much, much lower. So that's really fantastic. And then there are 2% of you that said, no, it all just seems so difficult. And again, that's a real shift in sentiment from the sector. So that's very, very reassuring to read. So thank you all for sharing a little bit about your the stage of your journey. Let me just stop sharing that. And on we go. Okay, so now we're going to open it up to our panelists to answer some questions. And this first one is to you, Anne and Chris. Could you define consumer involvement in research? You're both on mute.
Okay, do you want me to go first?
Yes,
over to you, Anne. Perfect.
Yep.
Okay, I've been thinking about this, and I, from my perspective, it's about consumers and community members having a voice in research. And so by this, I mean that they are valued members of the team. It's not an add-on, it's part of the process that you undertake when you start your research. And I'm talking about all sorts of research here, you know, right through from the lab through to what happens in the hospitals and in the clinical settings. And it's about having consumers as part of decision-making processes so that, as I said, they're not an add-on. And then this means ultimately that research is informed by what's important to the community. And I understand that people, you know, have got drivers and other reasons why they might do it. But if you're not including the consumer voice, you might not actually be hitting the spot when it comes to implementing your research.
Fantastic. Chris, would you like to add something in there?
Yeah, look, to echo Anne's words, I think for me, consumer engagement, and I've been involved as a consumer, and I'm actually now the consumer engagement manager in a National Research Alliance. So I'm sort of and a consumer that's been engaged, but also now engaging consumers. And I really feel that consumer engagement is really inclusion of all experts, because people with the lived experience are experts in the condition in which they have, or the parents of. So for me, it's really listening to all those voices to build a program or research that's going to have benefits for those people specifically. And sometimes I think we lose sight of why we're doing research, and having those consumer voices means that we are constantly reminded of why we're doing a certain project. And I think, you know, it's about building partnerships with our consumers. Like Anne said, it's not an add-on. It really frustrates me when it's a real tick the box process. So it's, for me, it's building a partnership in that sort of co-design process in research projects. And I think the other thing for me is that there are different ways for consumers to be involved, and I don't think it needs to be a one hat fits all. So we need to be cognizant that consumer engagement can look very different in different parts of that process as well.
I ask, and you might be able to assist here. I know that there is debate around nomenclature. So consumer involvement, patient involvement, public involvement. Do we need to get hung up on any of that, or is that terminology important?
Look, I don't like to answer questions like that, but for you, Mel, I'll make an exception. I just think that, you know, I transitioned from being a mother into having working roles in this space a long time ago. And, you know, I've been listening to this talk for nearly 3 decades, and I just think it's ridiculous. And you can call it lollies. I don't care what you call it. It's about having that voice. And so what I say, you know, when researchers raise that very question to me is, let's go with what the main funder of research in this country says: consumers and community members, and leave it alone. It doesn't matter. It's an umbrella term, and it can, underneath that, it can mean whatever it is that works well for you. Patients, parents, what carers, doesn't matter.
Oh, I love that, Anne. That's so important, because I think, you know, if that's the very first barrier that people experience, is trying to think about, I've got to be sure that I get the naming right, then that's an automatic barrier. And if we can get rid of that barrier immediately and say, just do it, don't worry about what you call it, then that's progress already. That's great. Okay, does anybody else on the panel want to share any thoughts around that discussion?
No, I agree. I think that, you know, when I sort of talk, I talk about patients and I talk about carers, because that's the part of the industry I'm in. But in the end, we're all the same. I work for a clinical research organisation, but I'm also a patient. I'm also a mother. I'm also a consumer. I'm a carer. So I think the nomenclature is, let's move on. Let's get to the really important things, not just what we're calling ourselves.
Fantastic. Okay, let's move to our next question then. And this is one for Leanne. So Leanne, what does active and effective consumer involvement and engagement look like in practice?
Oh, Mel, this is such a great question. When I think about consumer involvement and engagement, I think about consumers becoming involved, firstly, along the life cycle of a clinical trial, and then secondly, within an organisation to shape its its strategies and priorities. So I guess in both instances, it's absolutely essential to be able to define your aims and your objectives for consumer involvement. What's the problem that you're trying to solve, and how can insights from consumers help you solve those problems? And then lastly, what questions do you need to actually ask consumers to gather the insights? So if we think from the perspective of a clinical trial and a researcher throughout the life cycle of a clinical trial, consumers can be involved early to prioritise research and to ensure that researchers' priorities align with those of their patients, because lots of studies show that there can be some mismatches between what's actually researched and what consumers would like to be researched. So if you think about what that might look like, it could be making contact with an existing consumer group or a patient forum, or holding a one-off focus group to bring people together. And then the next stage in some instances can be seeking funding, and it's important to consider whether a consumer could potentially be a co-applicant and the value that this would add to the development and the delivery of a study. So in practice, this could also involve running a focus group to confirm the research question and make sure that it meets patients' needs, and or approaching existing patient groups to comment on a protocol, potentially even endpoints, and develop review patient-facing material. And then once the study is underway, consumers can help researchers to refine the protocol and review and develop trial documentation and ensure that the trial is delivered successfully. But in doing so, they can help trials become much more attractive to other potential participants, and that can help ensure that they're conducted in ways that are really sensitive to the needs of participants. And then lastly, you've got crucially dissemination to ensure that the findings of the study are presented in really simple and accessible formats that enable consumers and communities to access and understand those research findings. So in practice, what that might mean is potentially co-authorship on manuscripts, summarising information for disease groups and advocacy groups, and promoting this information through their own networks, and also speaking at conferences. So if we go to my second point around consumer involvement within an organisation at a strategic level, that really helps to ensure that an organisation's research policies and practices reflect the real life needs and preferences of consumers. So this might mean a consumer could come on as a board member or an advisor for a shared decision making, so kind of a long-term partnership, or it could look like a one-off ad hoc, I guess, collaboration for consumers for something specific, and that might look like interviews or discussion groups or forums. So I think, yeah, it can be tricky to know if you are not familiar with these concepts or where to start. What should you do first, and what should you be thinking about? And I know that we'll have an opportunity to talk through the toolkit later in this discussion, but I just wanted to flag at this early stage, if researchers and trialists are not sure where to start, it can be really helpful to hear from other individuals with direct experience around what the benefits are from a consumer researcher partnership. So we've got 6 short videos which outline separate examples of research consumer partnerships from either the perspective of the researcher or the consumer, or both, about those benefits. And just one example, you can hear from an individual, Zai Phillips, who has a child with muscular dystrophy, and he talks about how he contributes to clinical trials via a consumer group to design studies that work around the busy lives of families and their needs.
Fantastic, Leanne. That's great. Thank you very much for that. I want to just expand on one of the things that you talked about there around the governance. So from an institutional perspective, how we can start from a top-down approach. So if organisations embed these principles within their structures. And Anne, I wanted to ask you, because Telethon Kids, I think, has been really an exemplar in this space. Can you talk about how Telethon Kids has really made this part of their strategic objectives?
Yeah, thanks, Mel. Look, I think when I think back, it's nearly 18 years ago when we started, and what we did was hold workshops first with researchers and then with consumers who had an interest in the research that was going on. And this was about putting in a formal program, because I was employed under a capacity building grant to increase consumer participation, as it was known at the time. And so we held workshops and asked, both groups what they wanted to get out of it. And then we had, a simple quality improvement plan and, about what's happening now, where do we want to go, let's do it. And then let's go look back at what we've achieved. And, when I look back now, that plan that was written in 2004 is still very relevant today. And it's about bringing people on board, as you go on, and sort of like dealing with the barriers and asking people. And, like as Leanne said, you can have consumers throughout your organisation. And, look, I'm really pleased to say at Telethon Kids, nearly 18 years later, we have over 450 people on decision-making committees across the Institute. And it's part of the strategic plan. So it's about, staying on message and, saying that, I always say, because that we run training workshops and they've been the thing that's turned the light on to actually embed it throughout the organisation, is about saying, well, researchers, see, a research nurse and a biostatistician and all those people as part of their teams, but the consumer should be part of that and have an equal status in the team. So, I think the training has been important. I think having a plan and then having someone to stay on message. So, Chris, I just think you've got a long time to go, and hope I'm around to look back in 18 years and say, look what she's done.
Liz, how are IQVIA as a CRO and as a group that are really committed to consumer involvement, how are they doing it across the group? What does that look like from an organisational perspective?
I don't think that the problem is, I guess, as being a CRO, is you're working with multiple sponsors. We are not a single entity ourselves. And in the continuum of a clinical trial, we're starting from, the inception with multiple sponsors in different parts of the world with different outputs. So I think where we need to add consumers in is maybe working alongside sponsors. So one of the messages is we've got, if you think about a clinical trial, and that's what I do day to day, less than 5% of our patients, consumers, healthy volunteers, actually are on a clinical trial. So there's 95% of the community that's not on a clinical trial. So obviously we sit in meetings, as we all do, talking about what's wrong, what have we done wrong, why aren't we getting these patients, consumers onto their disease trials. And I think it's important that we're not involving them. They're the people who are not going on the trial. We sit and have meetings and decide, we think it's this, or we should have more people. So we just add people. We add people into the mix. Let's have another committee. Let's have another group. And in the end, we're not getting to the right people. But we have to be careful there. I always talk about a clinical trial and think sometimes the eligibility criteria is like trying to find a unicorn. They just don't exist. So having a consumer involved, but it's also the right consumer. You can't just, where do we involve these consumers? Are we looking at a particular protocol? Are we looking at a disease therapeutic area? For example, and this is again, so for your question, it's sort of, I think we need to embed them at a sponsor perspective, at a government perspective, at a community perspective. Do we have sort of, because in a therapeutic area, for example, we may have a clinical trial and we go, the output, the objective of rheumatoid arthritis, for example, is going to be pain. We're looking at pain scores. But from the patient who has rheumatoid arthritis, maybe it's the fatigue they suffer. So we're looking at an output, and we've all decided, because we're so infinitely smart, aren't we? Here's what the output is. Yet for a patient, they're going, that's not my biggest problem. So we might be directing the whole thing into what they're not looking for. And I think we have to decide then, you know, who we involve as a consumer. So do we have, you know, I think we undervalue our nurses, our coordinators, all of our hospital staff who are sitting there with the patient every day going, I'm talking to them, I'm listening to them, I know what's wrong with this particular protocol. But by the time they get to have a say or a voice, the protocol's written, the study's ready, we're all starting off, and then we have all the failures, and we don't. And I'd love to see this. We do it at IQVIA with our staff. We have lessons learned. So we look at a particular study and what went wrong, what could we learn? Why don't we, or somehow, if we could have like a questionnaire somehow that went through ethics, got approved, and we had the participants, the patients turn around and say, hey, in this study I was in, I didn't like this, I couldn't come every week because you wanted me, you know, as you think about, you know, we talk about cancer a lot. Cancer patients used to say you die from cancer. Well, now you're living with cancer. They're all working. They're all got, you know, full-time jobs. And we don't think about that. We say, we want you to come every week to come on this study because we know what we're doing. We want you to take the whole day out to come and do all these tests. So again, do we think about that and use our consumers to go, that's not going to work for me? I think there's so many things. I think you're on mute, Melanie.
Yeah. No, I think you raised some really good points, Liz. And one of the things that we've been trying to encourage clinical trial sites to do is to think about that, at least bringing the consumer voice in at the end of a study so that you can understand what works and what doesn't work. But I've been reading quite a bit of stuff recently around startup efficiencies for some work that we're doing with the New South Wales Cancer Institute. And all of the evidence points to the fact that startup and recruitment are all enhanced when consumers have a voice at the table and they are helping to design the research that meets their needs, because then they want to be involved, not what we think is important. And
that's just before you, that's very true, because we have there's a US patient who was on one of our studies, and he had stage 4 melanoma. It's gone to the brain, and he was waiting for the trial to open. So it was in the startup, and the holdup was contract negotiation and execution. And he actually took it upon himself to go to the sponsor and say, my life is in your hands. Someone needs to sign the contract and let me start on this medication so I can do better. And he's still doing well. And to everyone, it was gobsmacking to go, oh, that's so true. We forget, we get lost in the trees. We forget there's a patient at the end of all of this. Sorry, yeah, I just thought that was important to add in.
And did you want to say anything there?
Yeah, look, I think, you know, it's great to bring consumers in at the end. And I'm really excited by the idea that you ask people, what can we learn from what we did? Because I think that's part of that continuous improvement project. But I also think that, you know, designing trials, particularly without the consumer voice, as you said, about can I come at that time? And, you know, when Leanne talked about a video of a father and his son and the researcher on the toolkit, when you listen to what happened for that particular group of people with boys, mainly boys that have muscular dystrophy, I was at the meeting where they actually said to the researchers, well, this is a really important study because it was a clinical trial to look at, you know, breathing in the night. Look, I'm not a researcher or a clinician, as you can tell. But anyway, they were going to do a sleep study and they wanted these boys to come in to the hospital. And the parents said, you know, look, we think this is really, really important research and we're happy to take part. But you know, the idea of having to get these boys in to do an overnight study is just too hard and we probably won't take part. And so one of the parents said, have you thought about letting us do the sleep studies in our homes? And, you know, like, it was like, well, hello. Yeah, it was amazing. And, you know, like they sort of looked at each other and thought, well, you know, why not? And so they went about it and they've changed that trial to be done in the homes. And, you know, that was just amazing. Whereas I think if they'd have done it the way that they were planning, they wouldn't have had participants in there.
And I think that's important to, you know, you're right at the beginning, and we have to make it broader, I think, than just a particular clinical trial, because we've got there's thousands of them. So you get a consumer group. So with Chris's group with epilepsy, and start by looking at the therapeutic area itself. Where are the holes? What are the most important things? What do we need to know? Okay, now these are the sorts of studies. Let's work. So, and those consumers are probably, you might have that voice, you might have those advocates that are the people who are the spokespeople for the community. But I think that you're right, and it comes right back at the beginning of that whole therapeutic area. You know, our family are in, this is the condition that we're talking about. Let's start here and then move it, and eventually it'll filter into all the individual protocols.
Wonderful. Look, we're starting to get some questions come through. And Joseph, we're going to answer your question around the role of a HREC and bring Trina into this conversation in a minute. But we will get to some of these other questions, but please do keep asking. Let's get to our next panel question, which is around, and Liz, this is for you, but open to all of the panelists. So how do we choose the right consumers, and where do we place them in the clinical trial space? And I think this is a really important question, because actually making sure that we've got the right consumers at the table is just as important as making sure that we're asking the right research question. So Liz, did you want to?
I'll probably just start with it. I've spoken a little bit about it, but a couple of groups. So again, my sort of pet area, I guess, is in cancer, but I think some of it is around, you're exactly right, how to best represent the group of consumers with that particular condition for that particular. So as Anne was talking about the sleep study, or Chris and epilepsy. So you might have a group of, you know, consumer advocates or consumer voices. So there is a group, for example, and I'm not affiliated with them at all, but say Cancer Voices Australia or Can Speak Queensland, they provide a voice for all of those people affected with that particular condition. And so they've got that community voice, but then they have the right people to then be able to, I guess, to be the conduit to say, I understand what the consumers are saying. It's a bit like a patient informed consent. We have to have that as a certain, you know, grade 6 school level. But when you're talking to an investigator or a clinician or a senior medic, you want to be able to have that conversation translate across to what consumers are trying to say. So I think having a voice or an advocate is a good way of doing that. And then where do you place them? You know, how do you do that? And as I've sort of alluded to, do you have formal structured activities? Do you interview people? Do you have focus groups? Do you have consensus groups? Do you do informal things? So maybe, you know, have sponsors, for example, have community meetings and or advisory meetings, or get feedback. I mean, there's so many different ways, but I think each, depending on what your objective is what you do. And then do you do it face to face? Do you do video? You know, how do you bring all these consumers? But I think for me, it's as Chris has got a group, I think have a conduit, have an advocate, have a person who can represent the voice, if you like.
So Chris and Anne, can I ask you to jump in here and say, how do researchers, and this is a common question, and I can see your eyes rolling already, Anne, but how do researchers find the right people? You know, because it's second nature to you, but how do we reach out to find the right groups? Is there a central conduit, or is it a matter of really doing your research and understanding where the communities sit? I think we are.
I was waiting for Chris to speak.
Oh, sorry.
First, so, yeah.
I thought you'd frozen it. I'll just jump in. I think in my experience, both as a consumer and then sort of engaging consumers, is that we have to make sure that it's not a tap on the shoulder. I think that happens a lot in our industry, and we need to make sure that process is clear, transparent, and it's an open process. And I think that how do you choose the right consumer can also be coupled with how do you make sure that they're capable, making sure that they've got support, they're trained, and they're capable of the type of engagement that you want to utilise them for. And there's ways in which, you know, the sponsor, the researchers can do that. And I'm a very big advocate of open and transparent engagement and opening that space up, because you can get caught in getting the same consumer voice a lot of the time. So I think that's important.
Yeah, I think that's a really important point, Chris, and I'm sure you would agree, Anne, because you know you must have had so many taps on the shoulder that you've got a permanent bruise, because that we do have the same voices constantly, and we do need to put our hand down to bring more people into those conversations, don't we?
Yeah, I think the thing about finding the right consumer, and you're right, I do roll my eyes about that, because how do we find the right anything? I don't believe people can really be representative, although when you're speaking for a big organisation, you know, you can bring the perspective of your organisation, but I don't think any of us are ever really representative of everybody. And so I always think that's a researcher paradigm, that you need to have representativeness, whereas I think with consumer involvement, you can have the consumer perspective, and whether you do it from, you know, an organisational perspective or from an individual perspective, you need to make sure the person that you've got is on board with what the research is aiming to do, because that's really important. I think I do say to consumers, you know, you need to be effective, and it was never ever in my interest to introduce, you know, a consumer who's got a different agenda to what the research has got. So I think that's really important. I think consumers require training. Somewhere in the chat, someone said people don't know about engagement and involvement. You're right, they don't. They just want to get better, and they want to live the best life that they can. So all of this stuff is really work stuff. So I think we've got to make it easy. We've got to offer training. We've got to offer ongoing support. And at Telethon Kids and University of Western Australia, we had developed a matching service, so that we made sure that consumers applied for a role that was being advertised, and we wanted a statement, not a CV, just a short half-page statement to say what they thought they could bring to the role, so that, as I said, it was really important we were matching, you know, like for like, rather than someone that had a different agenda. And you know, that happens, doesn't it? People have a bad experience with health and they want to make it, you know, right for whatever reason, and they may come with their own agenda. So we are, in the training that we do with consumers, we talk about not overusing your story, but being effective and making sure
that's great. Look, I'm going to jump into sorry, I think my internet connection is a bit bumpy. Okay, are we back? My internet is a bit bumpy. Can you hear me okay, everyone?
Yep.
Okay, I'm going to skip this question because I'm going to come to you, Trina, because there is a question in the Q&A. Can you hear me okay? Am I coming across all right?
Yes, can hear you, Mel.
Yep, good. And I think, Trina, this is such an important question when we're thinking about what are the levers that we have within our sector and within our realms of possibility that we can pull to really embed consumer research. And I think that HRECs form a really important part of that landscape. So what can HRECs do to support and encourage greater consumer involvement in research? And this goes to Joseph's question as well in the Q&A. So really keen to hear what you think, Trina.
Thanks, Mel. And it has been interesting thinking about what HREC's perspective is in the consumer engagement. And I think even going through it, I just kept coming up with more and more questions rather than necessarily answers. But given that Australia has got a lot of work to do compared to some other jurisdictions, we do need to be thinking about those questions as well. So I think there's probably direct and indirect ways that the HRECs can become involved and support it. If we think about that, you know, if the research shows that having consumer engagement does actually make the research better, it does make a better quality application, it does help design a better question, it therefore then helps design a better study design, it makes the information for participants better, then that actually is inherently going to lead to a better application for the HREC to review. So there's kind of I guess, an inherent role there for the HRECs, that there's going to be a better quality application, therefore maybe potentially a quicker road to approval. So the HREC role becomes part of that bigger picture. But there's probably, and because there are those frequent questions coming up around ethical concerns and design, so it is important to have that consumer engagement to be thinking about, you know, how is the design aligned with the needs of the people that it's trying to help, and what are the benefits of the outcomes for those patients, and is the way that it actually is intended to be conducted actually going to work. So there's sort of that inherent maybe build of the design that you would hope actually comes from that consumer engagement, and therefore lead to a better quality application, and therefore lead to a quicker outcome and a higher quality approved research project. But there's probably also opportunities to consider about how the HRECs can actually drive that role a little bit more as well. So can we be more directive in requiring specific evidence of consumer involvement when an application comes in? So how can we actually do that? Maybe there could be a specific question on an application form, but what does that actually look like? So would the question be, would the HREC expect to see to show that there is something like as simple as a question around, have consumers been involved in the design of the study? But we could also think about it more broadly about, well, what's actually the purpose of wanting consumer engagement? So the question may be more broad around, well, what is the patient need that you're actually addressing? And then that leads to some information from the researchers that builds in the consumer support that has been added into the study. But I guess in adding those questions to an application, then for me was thinking about, well, from a HREC perspective, what would the committee actually expect to see as an answer to those questions? What would be acceptable? What would, you know, when would the committee be asking for further information? And then how are they actually going to assess that information? And I guess coming back to some of the discussions before as well, would there be different criteria for different types of studies? So, so what does the committee actually need to know, and how are they going to make that assessment? So, so as I say, there was sort of lots of questions out of that, and that's probably what also needs as part of these discussions is what guidance is going to be built to help support not just the consumers and the researchers, but the HRECs as well, to be able to support this. Because we need to understand what the consequences and implications are. It's not just enough to know there's consumer engagement. I think coming to the point of, you know, even our question today, to make sure that it's actually meaningful consumer engagement. And as Anne and Chris were saying, it's not just an add-on, it is an important to be making sure that it is really justified and that it does add to the actual study, and therefore what the ethical oversight of the document needs to be, not just in the initial application, but right through the whole study as well. So I think it's really important to have these discussions. They're obviously been happening for a long time, so we really need to build on how we can actually support this and put this into practice. So I think that's it, Mel. As I say, lots more questions and probably
That's a
actual
great
answers, but
no,
yeah.
that's a really great response, Trina. And I think what you've done is highlighted some of the complexities, because I think you're right. You know, it seems apparent and obvious just to put a statement in an application that says, and I love the way that you framed it around, you know, does this meet the consumer or patient group need? That's, you know, asking a broad statement rather than have you invited, you know, which could be a very simple response. But then understanding how a HREC assesses that response. And I guess this begs the question as well, we have lay people on HRECs, but do we need actually consumer representation from those who are very skilled in this space? And I'd open that up to Anne and Chris. Chris, what do you think?
Yeah, look, I'm trying to think of different scenarios that I've been involved in. For example, sat on MRFF as a consumer rep, and the question was there, and consumer involvement was sort of splattered through the applications, but it was still very much a tick the box. And as the consumer rep on that process, it was really hard to assess. For a number of different reasons. One, because it wasn't my area of expertise, but, you know, when in running through what does good consumer engagement look like, none of them met it. And then it wasn't backed up, to your point, Trina, by, if you're doing consumer engagement, there was no wording around what that looked like. There's no funding line for consumer engagement. And I think, you know, we need to move the needle forward. You know, we've been talking, you know, to Anne's point, for this, you know, for many, many decades now, and the needle needs to, I would say, jump forward rather than sort of slowly move forward. But it needs that structure in place to make sure that from everyone's perspective, it is understood and supported.
Mel,
And what are your thoughts? I know that you've done some work with HRECs in this space.
Yeah, a little tiny bit. I'm sat on a HREC for many years and was frustrated about my lay person saying all the time, but the researchers said it'll be good, so it'll be fine, Anne. So, you know, I found that quite a difficult time, but I hung in there for a lot of years because I was very committed to the organisation. But I think, you know, definitely, Trina, there needs to be a question about consumer involvement in there. I think NH and MRC, for all the good that they do, have actually quite siloed HRECs and consumer involvement, and now the MRFF, you know, they're trying to address that by asking a question, but there's no criteria to measure it by. There's no standards about what is good consumer involvement. But look, I agree with Chris. The needle needs to actually go put on full speed and you know, get this happening. Other countries have done this. Why are we still talking about it? We need to actually, you know, work with organisations like Bellbury to actually say, okay, well, we're doing it, and you know, that's it. We're just going to do it, and we're going to set up what good involvement looks like. We're going to have some criteria, and we're going to ask those questions, because as a HREC, you would find it really difficult to say, well, we're not going to give approval for this, when you've got a consumer group that's actually answered all of those questions to say, we need this to happen. You would find it quite difficult to actually go against that. So I think it's time to just do it. Stop talking.
And I think you're right, Anne, and what we have to do, there's a difference there too between, say, a collaborative research and, say, a commercially sponsored research, and whose responsibility it is. We don't want it to end up being the poor site that's lumped with, oh, did we involve consumers? It's right back at the sponsor level at the beginning, when they're the ones with the molecule that they're testing, saying we are the responsible parties to have a consumer group involved with discussions. I think that's important.
There's a question here that relates to this topic. And I'm so with what you're saying here, Anne, is that, you know, we need to stop the talk and we need to drive the action. And I think that if we wait for the sponsors, we might wait too long. Researchers need to potentially be the catalyst here. And let me just go to, so there's been a couple of comments from people around the role of the NHMRC and embedding consumer engagement and involvement in the national statement and referencing the guidelines that already do exist around consumer involvement, noting that they are getting a little long in the tooth now. But Yun Hee says, we cannot impose on this in the current research process. To me, the more important question is how researchers can do authentic consumer engagement and involvement before ethics approval has been gained. I believe the driver needs to come before we get to the HREC. And I think that's a really important point, that researchers need to play a pivotal role here in making this happen. Over to the panel. Leanne, what are your thoughts?
Mel, I completely agree with you. I think it needs to start from above, and the changes required are structural rather than just leaving the sites to get on with it. But I'd be interested to hear from everyone else.
You know, I want to ask Trina, is it possible to actually lead the way with Bellberry and, you know, say, well, we're going to, you know, have a project, I don't know, whatever you want to call it, to have a question in our ethics applications and develop the work that goes underneath that. And yes, the statement is there, and yes, it is long in the tooth, and yes, there is work to be done on the NHMRC CHF statement, but I think, you know, it needs someone to do it and to drive it. So is it possible?
Yeah, so certainly from our perspective, we're really supportive of trying to develop increased consumer engagement. We've actually made a decision to look at some projects which can see how we can demonstrate that that visible commitment. So yes, we certainly are looking at that, and some of that work is being done in conjunction with Leanne in the CTIQ, some of the CTIQ projects that are coming out as well. So I certainly hope we can get some practical outcomes out of these projects. As I say, particularly a few that Leanne are looking at with the CTIQ and where we can become involved with those. And as you say, it's been a conversation for such a long time. So to actually get some practical outcomes and find out ways, I mean, coming back to what you were saying before about how we can actually help the researchers as well, because ultimately, I guess as I was touching on the beginning, if the researchers are involved, it's a better quality application. It's going to become a better outcome for, you know, going through the HREC process as well. So there should be multiple ways that we can actually approach this and really get some, concrete ways to actually show that this can actually happen.
And there's so much, you know, if you think about it, government grants being given out at the moment to sort of equity of access for patients, you know, the remote, rural and regional, all that sort of thing. So we should be able to dovetail onto that, because that's really important as a consumer to get their voice at all of that, you know, through this. So, you know, is it a good time that we dovetail in on that?
Mm.
So let me just go to the audience now, because we do have quite a few questions coming through. So again, and this is a very practical question, but I think it is an important question, particularly when we're talking about the role of researchers. Is there a central body or a central group, and I've just got to find, a registry of consumer organisations that we can direct researchers to so they can find consumers to engage? And eyes are rolling again. Besides the CHF, what do we have, Anne?
We don't actually have a registry as such. I know here years ago in Western Australia, we had a an organisation called WISH, and it was West Australia's Institute of Self-Help Organisations. But and they put out a book, but you know, I'm sure it's online somewhere. I don't even know if it still exists, but that had all of the consumer involved consumer organisations in WA. So you know, there's things like that, and each state has its own consumer organisation. You know, WA has Health Consumers Council of WA, and I know they're in the states and territories. So there's places like that, but there's also so many disease groups. I think you would be hard put as a researcher to not know that you could access some consumer groups somehow. So I think it's a bit of an excuse to think there's no central body, so I can't do it. Whereas, you know, every condition, I would imagine, has some sort of patient group, support group. So,
and in some respects, we're researchers and we're autonomous, and we have a responsibility to go and find the right people. We shouldn't be lazy and expect that they will come to us. We need to go and do that piece of work too, because that's what engagement and involvement is about. It's about actually being actively engaged
and getting out to the community. And you know, you've got a captive audience. If you're running a clinical trial, you're in the hospitals and you're talking to patients. Put a sign up to say, you know, there's an opportunity for you to be involved. It's a very simple. Sorry, Trina, if that's part of your HREC process, but you know, I think it's simple to get out and access, you know, patient groups, etc., without worrying about having a central body, because there's so many of them, you couldn't keep up with it.
The next question, and this is very much the elephant in the room, and it's around funding, because how do we ensure that we include funding for these activities right from the concept stage? Because without that funding, then that is just another significant barrier that perhaps we'll never overcome. So I can think about ways that researchers can do that, and you know, and they need to include evidence in their grants in the public grant space of consumer involvement. So that should be reflected in their budgets. But how do we drive this from a clinical trial perspective when budgets come down from a sponsor who hasn't even included that in the design? Liz, what do you think?
I think it's just, you have to start doing it. I mean, every time there's a new clinical trial, or every 6 to 12 months, a site has different charges. So COVID has been a great example. Charges in budgets have changed because there's remote monitoring, there's more, you know, at-home visits for patients. So we've been adding those things into budget. So now we're really on and talking about consumer engagement. I think that has to come back at a sponsor level to say, you know, they have marketing budgets, for example. So part of that is in our clinical trials, we allow money, they have budgets for advertising for the clinical trials. Maybe we have to, or maybe we should have an area where there's going to be a certain amount for consumer engagement in the whole process. And if you think about it, as I've said before, that ends up tying and dovetailing along to patient recruitment, startup, all the pieces of, you know, getting more patients on a trial. So in fact, that you know, as if you're trying to say it to a sponsor to make, you know, to think about the positiveness of that, you can say you will get, you know, you'll get your study done. We're going to access those patients that need to talk about it up front.
I guess there's a role there for CROs and groups like IQVIA to actually say to their sponsors and their clients, all of our budgets will have a line item around consumer involvement, so that they are aware, and then it goes to the site, and the site recognises that there is an opportunity for them to get funded, and that will be a catalyst for change.
I think you're right. I think it's true. And that's where in the middle from both sides, from, you know, representing the sites and representing the sponsors. So that ability to say, you know, this is the hot topic. This is, and we're starting to have these, you know, you want to have these discussions, as you said, the elephants in the room. You want to start saying, this is what people are asking for, this is what patients need, and what the industry needs. We have to start to and adding those costs in. I think it has to start somewhere.
Can I ask a question, Liz? Sorry, just because my experience as a consumer,
Sure.
as we're sort of heading to clinical trials, that all the sponsors or all the organisations actually have a consumer engagement person. And so they're working with consumers, but beyond that, what would be the expectation in terms of, I guess, funding and, you know, what that looked like moving forward?
And when you talk about with a sponsor or a company, if you like, and a consumer engagement person, I think that at the moment, this is my opinion, is that it sits in the marketed space. So that medication is marketed and then they're looking at consumers about its use. My feeling, and I could be wrong, and I'm happy for people in the audience to let me know, is that at the trial, when we're trying to get a drug that we haven't marketed yet, we're putting it through the clinical trial space, have we got those consumer advocates for the sponsor working in that space? I think they're probably only working at the end.
See, that's actually not, just to be honest, that's not been my experience, because we're working in preclinical
wow, that's great.
space. So I've been engaged for probably 3 years, and clinical trials, hopefully, fingers crossed, will be next year. So we've been involved in that process and only just getting to the design process. Right. And they've actually now moved into, this particular company has moved into a consumer advisory council, I think they're calling it, I can't remember, where they're actually engaging globally.
Right. And is this a large pharma company? So is this what you're...
Actually a very small biotech.
Ah, right.
Yeah.
But are you seeing this in all companies or just what you're experiencing in the small group? Because I would have thought, yeah, but I'm open to.
Yeah, so, well, I mean, my area is rare disease, so I don't know if it's particular in rare disease, but every company that I've been engaged in, either as a patient advocate or in my work, they all have these roles, and they're reaching out prior and during the process rather than at the end. So really, I guess my experience has been a little bit different.
It's been different.
Great. Yeah.
Can I ask, Chris, are you being paid for your, because I think that's another real challenge in our sector, isn't it, is that we undervalue the role of consumers, and there's some comments in the questions about over-reliance on individuals because we don't have things like a registry. How can we ensure that people's time is valued?
I think for me, it's a tricky place to be in, specifically with the biotech company, because I'm a representative of a group. So how do I get paid when, I'm just trying to have a voice, and to be honest, I'm batting really hard to get clinical trials to Australia. So I feel like for me, there's a bit of an ethical line. In terms of the Consumer Advisory Council that they're set up, there actually hasn't been a conversation around payment, so I might actually ask them that. But in terms of my role kind of as the lead patient advocate in that space, I'd be interested to hear other people's opinions, but I haven't felt comfortable, even though I do a lot of work for them. I've already had a meeting at 7:30 this morning with them, but for me, it's a bit blurred in that space.
Mel, can I say something here, please? I think Chris has just highlighted something about it's blurred, it's difficult to ask for money for something, when you're meeting at 7:30 in the morning. There should be, across the board, an agreement that why would the consumer be the only person in the team that's not being paid? And I think we over-rely on people's good nature and their want to actually make things better. And I think it's different if you decide to become part of an organisation and take on a role in a voluntary capacity, like on a board or something like that. But I really advocate for the payment of consumers, because I think they shouldn't be the only people not being paid, and it should be part of the budget. And I see in the questions there's something about, you know, if a company has got consumer advocates in America, you know, is that suitable for here, for Australia? Well, that's a separate question, but because the answer is no. But, you know, the other thing is that in America, they are paid. And, you know, pharmaceutical companies or, you know, industry pay in other countries. They pay in the UK for patient and public involvement activities. Why not here? We shouldn't have people like Chris being in a difficult space. She should be paid. And then it's up to you, Chris, whether you want to give that back to that organisation that you're there speaking on behalf. But
Yes.
And I think that's the point in what you do. And the only, it's not difficult. The only thing you make sure is it's not biased. So it's like if you have a healthy volunteer study and they're remunerated, but it's not to the point that it becomes, they could be biased in their opinion. So it's easy. We do it every day with healthy volunteer studies. So it's not something we can't do.
But I think, you know, another solution to assist with this is to have some structure around what that looks like. So what does consumer have a consumer group that describe what is equitable in regards to remuneration, so that people aren't guessing and so that it's standardized across the board. So perhaps that's another lever that we can pull to make this more possible. I'm just going to go to, so Karina has just left a comment here about some work that's happening at Sydney local health districts, where they have initiated a project that includes adding questions around consumer involvement in their ethics applications, and that's going to be included in Regis. So that's great news. Well done. Suzanne has asked a question around how are hospitals with their new accreditation governance standard taking on consumer involvement. Some investigator-initiated trials should have a disease group to consult, but what about the commercial trials at hospitals, and how is consumer involvement demonstrated in alignment to this new government standard? So I think this is where we're going to see, this might be another lever for change in the sector, is that we now have a standard that you know, requires us to demonstrate our commitment to this. Leanne, did you want to talk to that? You're on mute.
Might help if I come off mute. I was actually reflecting back on your previous question, Mel, because I think it's relevant to this question as well, around what levers can we access? And I think another elephant in the room is money, and being motivated by making money. And I was thinking back to a couple of studies that we quote regularly around what are the benefits for involving consumers, and, you know, to justify that return on investment, so to speak. So there were a couple of studies that came to mind that the British Journal of Psychology reported. They looked at 374 studies, and trials with the highest level of involvement were 4.12 times more likely to recruit to target than those that didn't have consumer involvement. And the other one that I was thinking of was conducted by a CRO, PRAXIS, and they looked at patient-centric designs, and they looked at various levels of how patient-centric the design of the clinical trial was. But they found that, again, there was a correlation between the higher the patient-centric design, the higher the higher recruitment rate, but also critically, it was 19% more likely to actually be launched. So I think that's worth keeping in mind for both biotechs and farmers when needing to, I guess, have that conversation around being what is the reason. I mean, we all know that it's the right thing to do and that it's going to benefit everyone, but for those in some of the top CEO jobs that are motivated by money, I think there are good reasons there as well.
Yeah, so use the data to tell the story.
Yeah.
Use the data that says, actually, if you invest in consumer involvement in your research, then your returns will be significantly improved. Yeah. No, it is about telling the story, isn't it?
And Mel, just to add to that quickly about patient centricity, and that's the point, having consumer involvement, but we really have to, it's another one of those buzzwords. Are we really making it patient centric? We actually considering the patient and the consumer who is the patient, or are we calling it patient centric? I think that's something we've really got to make sure we're actually doing, not just saying.
And I think, Mel, that's where HRECs can come into the picture here to make sure that, as I said, there's some sort of guidance about what real involvement looks like. And I think I was thinking back last night when I was thinking about these questions very early in the piece. The person that I worked for at UWA, he said engagement or involvement at the time was about having a planned budgeted strategy. And so I think that budgeted point, I always look when I read grant applications, I look for that planned budgeted strategy, because I think if you're going to the effort to pay someone like Chris, then, it's real.
Yeah. The organisation is much more likely to value the contribution.
Absolutely. Now, Alan, just before we get to the next question, Alan raises a really good point here when he says that there is an additional burden placed on the researcher, because consumer support and consumer engagement implies not only just involving them, but actually education. So how do we, if this is to become part of a research application, doesn't this place a significant burden on both the researcher and the potential participants? And how do we minimise that burden to the researcher? Because if we don't make things easier, then it's just not going to get done. Who wants to tackle that? I think it's about what education and resources, go for it, Anne, but what education and resources exist already that we can point them to, and how do, particularly for education for their consumers, but also understanding how they can, make this a reality from a research perspective, from their own perspective as well.
And is it also not just at that one researcher in that area, but we're trying to keep things very generic. So we're, maybe, utilising, as you said, what's already there in those large therapeutic areas, or the rare disease. So we utilise what we've got and take that first, so that, there's a pool of information we've already got, and just being careful that if we drip it down to each protocol, each study, then it's going to become a lot more burden on the researcher, which is not what we want.
I think,
go
on, Anne.
No, you go, please.
I was just going to say, I think also most researchers will sit in an institution of some kind, and most of these institutions are now being, mandated or choosing to have consumer engagement leads, and we should look to them for support, because no doubt they've got either access to resources or training. I know that Anne's done a lot of online training through some of the organisations that I'm involved with. So I think there is some of those resources out there and support out there. It's finding it and making sure that that's an easy path to those resources.
Yeah, the National Health and Medical Research Council have put a lot of money into, and the Medical Research Futures Fund have put a lot of money into each state, or having at least one academic health research, I'm not sure, ARTEC. I try not to talk in acronyms, but I'm doing a bad job today. But and then there's an umbrella organisation that's ARA. Again, I don't know what it stands for, but it's an umbrella organisation that's trying to bring together resources. But Chris is quite right. Most researchers would sit in an organisation, and there are, through these organisations that are statewide, like here in West Australia, we've got the West Australian Health Translation Network, and they have a consumer engagement program. And then at Telethon Kids, we offer training. We've got people who support the involvement activities. And yes, we have done training outside our organisation, but there's lots of resources around so that it isn't a burden. And I think training and education is the thing that turns the lights on from being a burden to something that's going to give my research great benefit.
And maybe it's something that you do. We all, all investigators, for example, network. There might be a tumour stream group or their specific information or a therapeutic area, but maybe it's the question they're not asking. Or in that, they're talking therapeutically. Well, okay, also talk about who deals with consumer groups. What have you done? What's your experience been? Where do you get your information? And it's through that networking. We always say networking is so important. Well, yeah, maybe you are going to learn that. Maybe everyone's doing it, but they just don't know what others are doing.
So really important takeouts there. Speak to your institution, find out what resources they already have committed to, because you don't need to do this alone, and then find other examples of what has worked. And this really leads into this next question. And Leanne, I'm keen to get your insights here, particularly around the involvement toolkit. But what are some of the tools we already have available? And how can we use these to just get started? Over to you.
Oh, thank you. And Anne Mackenzie, I know you'll have an awful lot to say about this because you contributed so significantly to the Consumer Involvement and Engagement Toolkit. So this was a collaboration between ACTA, who did the majority of the heavy lifting on this project and was led by Nicola Stratton, fabulous senior project manager, and a huge working group. And CTIQ also brought industry to the table on this particular project. So I guess what I should do is describe it first so you know what I'm talking about. The Consumer Involvement and Engagement Toolkit is an online interactive platform. We refer to it as a bit of a living repository of information that can be continually amended and updated, and that's precisely what we do. We're continually adding to it, which is fantastic, much better than static guidance. So the primary users are researchers and research organisations, and it's these groups that really need to know how to use it effectively. So the actual toolkit itself contains guidance and tools to facilitate consumer involvement and engagement right along the life cycle of a clinical trial and support really active and effective collaborative consumer partnerships with both researchers and research-focused organisations. But I will say it is our first attempt gathering all of this core material together. You can think of it as a bit of a one-stop shop for all of the national and international best practice that's been adapted for Australia. And there's a lot of novel content on there as well. So the actual toolkit itself, we won't give you a demo today, I don't think, but it lends itself to being portrayed visually. There's 4 different layers around understanding, planning, undertaking, and evaluating consumer involvement and engagement. And then there's lots of examples of content behind that. And you heard me talk before about an additional tab that we have for consumers. But in terms of our primary audience, trialists and medical research institutes, there's just so much guidance to help you get started. So please go and check it out. But Anne Mackenzie can obviously add a lot of life and colour to this description because she's responsible for so much of the content.
Yeah, thanks, Leanne. I don't need to add anything. I think you did a really good job. I think your organisation and ACTA should be really proud of what you've developed. There is also another toolkit on the Victorian Comprehensive Cancer Centre. They have a toolkit as well. And I think those toolkits are great starting points. And that's why I was really excited to be part of that ACTA CTIQ toolkit because, I just think it was something that was so needed and I wanted to contribute, the experiences that we gained along the way. Because as you said, Liz, it's about networking and sharing and really, putting this stuff together. And that's where I think discussions like this are so important, where we can share ideas and resources. So that toolkit is something that I would say to everybody who's online, you know, go on, if you haven't already seen it, do, because it's great.
Look, I absolutely agree, Anne, in our education. And when we're talking about consumer involvement, there is a huge education piece that needs to accompany this at a consumer level, at a HREC level, and that's certainly our area of interest. But when we're doing all of our education, we're talking about consumer involvement, and it's always front and centre, then we are pointing to tools like the toolkit, because we need to be reflecting on Australian practice. And we need to be really making, growing awareness around what exists, so that people have a reference point, because there is some really great advice in there about how to get started. So if you've never looked at it, then I absolutely recommend you do go and have a look at it. And the resources that the VCCC have also created, which are another incredible wealth of knowledge. While we're on that, Kath Irish has asked a question about accessing education for training consumers. And Anne, I know this is something that you've done a lot of work in with Telethon Health. And I know that there are different jurisdictions that have programs like New South Wales Health. But did you want to talk to where people can go to get training for their consumers?
So we've only ever done face-to-face training workshops for consumers, and I'm right now, excuse me, in the process of changing that, and it'll be an online, you know, module or modules. And I just sent the content off to my colleague in the UK who helped me develop the training for researchers to, you know, just to make sure I haven't missed anything. But we're, as I said, transferring the face-to-face to be an online module, and we're hoping, I haven't spoken to my bosses yet, but I've got a meeting today to say, can we just make this available for everybody on the Telethon Kids website? Because I just think it's so important about helping people understand what research is about, and then how to be effective. So that's something that we're developing right now. The researcher training, I honestly believe, you know, last year with COVID, we had to go from face-to-face to virtual, as Chris mentioned, and that's been, you know, fabulous that we were able to do that really easily, and we became, you know, masters at delivering training on Zoom, and which is quite difficult, you know, because you know, the flat faces of people is quite hard to engage. But, you know, I'm pleased to say that, you know, I think I've done about 154 training workshops for consumers and researchers, and it's what turns the light on, and, you know, says it's not that hard. It's about building a relationship and, you know, getting the benefits along the way. So training is really, really important.
So, and just, are there other resources that you know that might also be publicly available? I know that,
yeah, Cancer Australia has some that's available. Our researcher training is free in-house, of course, but it's done on a fee-for-service basis out externally. And I know Health Issues Centre have some training, and there are other places that are developing training as well. But again, you know, we seem to be all running off busily doing stuff, not so keen to share, you know, resources and things. So let's hope we can get that together too.
And it can be something, it can be something ad hoc, like, you know, consumer groups can ask for people to come and speak to them. I mean, throughout my life, when I was a pharmacist and even in hospital pharmacy, a lot of consumer groups would come and say, you know, patients of Vietnam vets, for example, I used to speak to the wives all the time about, you know, the whole about PTSD, drug therapies, all these things, you know, at their level. So, and I was really happy to do so, you know, because to me, it was like I'm helping and supporting and educating a consumer and their family. So I think that we underestimate that you can ask people to give you some ad hoc training too.
Yeah.
Okay, I'm going to bring us to our last question of the discussion. And I think this is a really, really important conversation. and I'm sure you'll all agree, around making sure that we include those groups, particularly from a consumer perspective, who have been traditionally underserved, whether they be from cold backgrounds or whether they be from First Nations groups. How do we do that better? Because at the moment, I think consumer voices in research really reflects a very anglicised white population. How can we improve that?
I'll start and then the rest can follow. It's been on. It's a bugbear of mine. You know what it is? It's too easy not to. In clinic where I work in sponsored clinical trials, you know, things about even down to a simple thing like translating a patient-informed consent document. We all say, oh, it has to be translated and back translated and all the work and all the cost. We're underrepresenting, like 33% of the Australian population were born overseas in a country not, you know, and born not in Australia. So there's 33% of our population where English is potentially not first language that we're just dismissing. And I think it's a real shame, and we should be actually saying, you know what, we have to do the hard work and the hard yards, but that's not representing our population if we don't involve them. And there's a whole, you know, if you like, a whole piece of the pie where we're missing what value that their input and their concerns and problems and education are having on what we're doing in the whole research sector.
Others?
I'd agree with that, Liz. I think we've certainly seen that from the ethics perspective as well, that sometimes it's easier to leave out a section based on, well, how are you going to manage this group, or that there's additional requirements, and then exactly the same concerns then, that we are losing an important part of the research question by then not including those groups. So I think this is a really important part of this question about making sure that we do find ways to educate and support and provide that motivation to be including these people including all people in the research that we do in Australia.
And what are your thoughts? I know you were involved in the ACTA work around culturally and linguistically diverse groups. What are your thoughts?
Well, I think it was a shame. I think it's our shame that we don't involve these people, you know, and that was a fantastic workshop that we took part in. And I always think about an Australian woman who was had Asian parents. I can't remember what country they were from, but she said that, you know, people who were recruiting for a trial after she'd had her baby walked past her because they, and when she went sort of chasing them more or less, they, you know, it was sort of, oh, I didn't know that you'd be able to fit the criteria because it was, you have to speak English. And she was born here. And, you know, I always think about that, and I think about a priority setting process partnership that we did at UWA, where we involved, you know, about 13 different groups, but we started off with the white faces that were self-funded retirees, and they actually said, we don't reflect the West Australian community. And we went out and talked to all these other different groups. We went out, and that was the key. We went out to the community, and people said, we've never been asked before. We're so excited to be asked. And, you know, they were texting their friends to say, come and have a look. I'm running to the bank to get more payment and buy more food. And, you know, but it was so exciting. And the big message was, we've never been asked before. So I think it's to our shame that we don't include people.
And we make it hard on ourselves, because we're just talking about the informed consent, that's one piece. But then we say, you know, oh, there might be an audit finding that in this trial, the researcher, how do you explain that the patient, the participant, they actually understood the whole part of the trial? And we're making it way too difficult for ourselves. We should be embracing those patients and making it work. And
I think it's an individual element here. It's about making sure that we're all questioning our own inherent biases when we are thinking about the role of consumers in research, and making sure that we are reflecting on diversity in all that we do. And in fact, a really important point here from one of our attendees who said, where is the researcher on this panel? So that we can hear the researcher's reflection. And I think that that's a really important and observation, is that, you know, this group needs to be representative as well. And we're not very representative culturally either. So we all have a part to play, and just to be very mindful of that. Let me just go to a couple of quick questions. We are out of time. I can reassure everybody that we will send you links to all of the resources that we've talked about, including, Leanne, if you can send me through those links to those papers. I've got some of them, but some of the others, that would be great. Can I just ask you as well, there is the link to the post-session survey. If you use your camera on your smartphone, it'll take you straight to the survey, and we really would appreciate your feedback. But while we're doing that, let me just see if there are any other final questions. There are a lot of comments which are really, really helpful, and people just reflecting on their experiences. Sarah from USC has talked about how they are involving participants. And they're doing some great work, and they're also doing some training for their consumers, which is wonderful. Jasminka has talked about the role of pharmacists, and that they've always been in that consumer engagement space, and that they have an important role to play when we're talking about decentralised trials. I think that's a really important reflection. Kate has also mentioned that Monash Partners provide online training for their consumer and community representatives. Let me just have a look at anything else. And Yunhee has mentioned researchers want to ensure diversity and inclusiveness. How is a big question if researchers feel it's too difficult? This is another aspect that requires infrastructure and policy level support. And I think you've touched on a really important point, Yunhee, is that we need a federal approach to thinking about how we can improve diversity and underrepresentation. Okay, I think we are done. As I said, we will send out links to these resources. Any final thoughts from the panel as we go around, as we leave the session, about your final tips on just getting things started? Anne, can I start with you?
I was on mute then. Look, I just think I've got to leave it with, you know, consumers add value to research. And if you're not involving them, you may not be getting the whole picture. So I think it's time to actually just do it now.
Thanks, Anne. I was on mute. Trina.
On mute too. Yeah, I think I'd just echo what Anne says, that it's about just taking the initiative to actually do some practical things. We can look at all the resources that are there, but build on them and actually put them into practice and work out how we can actually make this happen.
Wonderful. Thanks, Trina. Chris?
I guess I'd just add that there's a variety of ways to do consumer engagement. Like, it doesn't always have to look the same. And so don't make the hurdles too big for yourself, and yeah, challenge yourself to make the effort to include consumers, because it's a voice that needs to be involved.
Collectively, small change makes a big difference. Correct. Leanne.
Thanks, Mel. I agree with all of the panelists, actually, and I would also add that don't be frightened. Just get started. The tools are all there to guide you through it, and there's some great examples as well that also highlight the benefits if you need to convince anyone else in your organisation of what they are.
Liz.
I'm going to take a different tact. I think from this, and I feel like I'm almost in the audience, I'm going to be going away from this, and every time I talk to my hospitals, my sites, my researchers, my other CROs, my sponsors, I'm going to be asking them what they're doing. what are you doing for patients? Talking to my study coordinators, talking to my hospitals, everybody, and actually learn and network, use my network to actually find out, what don't I know? There's probably a lot happening that I'm not even aware of yet, but I want to find out now. I think it's, and then try and, link that together.
And I guess that's great, Liz. I guess my final takeout would be share the knowledge, share the resources. We do have an abundance of expertise in this country. Let's just make sure that everybody is aware of what resources there are out there. And I think, if we can all do that, then again, it will encourage people just to get started. And just to echo what Leanne said, start small. Start off with something that's achievable, that's not going to feel too overwhelming, but just get started. All right, everybody, thank you so much to our panelists today. Really appreciate you being here. Thank you to our audience. I think it was a great discussion, and hopefully there are some practical and pragmatic discussions that we had today, and that was certainly the desire for this discussion. Have a great Wednesday, and we look forward to seeing you at the next session.
Thank you, Mel.
Thanks very much to you.
Thank you. Thank you.
Thanks.